Just one second. All right. So let me start over. Welcome, everyone. Thank you for joining us today for our very first quarterly technical assistance, or TA talk. My name is Amity Overall Labe, and I'm the NORC director. And we'll have a couple other speakers on the line here shortly. We'll hear from Louise Ryan. She's the National Ombudsman Program Coordinator and also the Region 10 Regional Administrator for the Administration for Community Living, otherwise known as ACL. You will also hear from Maria Green, who you've heard from before on these NORS presentations, and she is a consultant with NORC. She does a variety of things with us. All right, so before we get started, since this is our very first TA talk, I wanted to go over some highlights and then another slide about some housekeeping since this is our first time. It's a very new format for us. We are in a Zoom meeting officially, so that's why we can see some of your faces on camera, and this will also allow you to ask questions using your audio instead of just the chat feature. So we're hoping this will be more of an informal feel and more of a conversation back and forth. During these quarterly TA talks, we want to connect directly with you so we can share some brief updates or new resources or even some reminders on specific topics. Respond to your questions live and provide time for you to learn from your peers or hear from some other subject matter experts. If you have any suggestions for future topics for these calls, please email us at that email in the slide. And also, as you may have seen in the emails about today's talk, we're now offering certificates of participation for those that participate in live NORC webinars. So you must register individually and then attend the live session using the individual link provided to you and attend for at least 30 minutes in order to get a certificate. The certificate will include your name, the topic, the date, as well as how long you stayed on the webinar. So we hope that this will help you fulfill your continuing education or in-service training hours a little bit easier. So there is a frequently asked questions page at that link if you have some other questions on how to get these certificates. But this is all new to us, so hopefully it goes smoothly. If not, we'll work out the kinks with the certificates, so just let us know. But they should be sent to you automatically. So a little bit about today's talk. You may have seen that we are recording this conversation, so it will be posted on the NORC website shortly after our live presentation. We are also live streaming it on Facebook. So if you are listening in on Facebook right now, you can't submit questions through Facebook because we won't see them. The questions need to come through the Zoom chat, or you can raise your hand and we'll call on you during the discussion part of today's call. And you can ask your question and unmute using your audio. Since it will be live streaming on Facebook, we want to give you a heads up that your image will be on there if you have your camera on. So if you don't want your image on our NORC Facebook page, you can turn your camera off. So just wanted to give you a heads up about that. You can submit questions in the chat feature at any time during the presentation, and we'll try to address them all during the discussion. And then at the very end, the very last slide after our discussion comes to a close, we'll have a link for an evaluation, and we really value your input, and we'd appreciate it if you can copy and paste that link into your URL, into your search engine, and you can complete that. It's very short. All right, so today's agenda. We're going to go over some NORS basics, NORS being the National Ombudsman Reporting System, as well as some important dates that you just need to have in mind as far as the reporting period. We're going to review some resources that we have available at NORC, as well as some other resources from ACL. We'll talk about how to get technical assistance whenever you need it. We will hear from Louise Ryan with ACL with some updates about NORS and just the ACL perspective about the importance of this data and your work. We'll have time for question and answers, at least 20 minutes, maybe 30 at the end, so should be plenty of time for those questions. And then, of course, we'll share our contact information for anything that we don't address today. You can always reach out to us. So with that, if you'll give me one moment, I want to see if Maria, are you on the line now? Maria Green?
I don't see her name listed.
Amity,
Okay.
people are,
Yeah.
we've reached our maximum. So do you want me
On camera?
No, on joining the event. So do you want me to get in touch with her and give her my link?
That would be great, because we increased the maximum and paid extra for it, so I'm not sure why it's blocking folks.
I'm getting messages.
So like I said, this is our first time doing this, so I'm sorry that we're experiencing some hiccups. So just give us 1 minute. Thanks, Carol. Okay, so while Carol is reaching out to Maria, I'll go ahead and get started on this section, and she can jump in whenever she joins. I'm not sure how many years or months or weeks or hours you all have on the job as a representative of the office. So some of you may be aware of this, some may be fairly new to the program. But in short, NORS, the National Ombudsman Reporting System, it is a uniform data collection and reporting system that's required for use by all state ombudsman programs. NORS was developed years ago based on reporting requirements in the Older Americans Act, and it basically provides ways for programs to capture and report their activities about complaints handled, other activities such as providing information and assistance and training, not just training for representatives, but also training for facility staff and so on. We at NORC have created a 4-part NORS training series. We suggest that you use that for initial training with representatives, but as well as ongoing training to just touch base and have some refreshers and see what other questions come up. The training covers, of course, the basic principles of NORS, complaint coding, and reporting other program activities. The materials, if you haven't seen them, include PDF documents as well as PowerPoints, and there are webinar recordings from when we did the 4-part series back in 2019. And we also have an online training course, which I'll review in a few minutes. Oops, sorry about that. So as I said, ombudsman programs report their activities such as facility visits, complaints received and investigated, information and assistance provided, and community education to the Administration for Community Living to be summarized in the NORS, NORS helps ACL understand and report on ombudsman program operations, the experience of long-term care facility residents, and changes in long-term supports and services, policies, research, and practices. ACL really uses the data. So what you submit in your monthly reports that then goes typically to the State Ombudsman Office and then will be fed annually into a system called OAPS, which is the Older Americans Act Performance System, is vital to inform ACL at the federal level. They can help shape and share information to shape policy. For example, when the nursing home regulations were revised, it really helped to have the experience of the residents shared through ombudsman program activities and data, and as well as sharing the ombudsman program response to COVID-19, as well as the resident experience. ACL has used the narratives that state ombudsmen submit in OAPS, as well as the data from your visits, cases, etc. State ombudsmen, of course, use their data at state and local levels to inform the public, raise awareness, and inform policy decisions. Their data is available in 2 places, on the NORC website, of course, at that link below, but also in AGED. If you haven't played with this before, it's a lot of fun. You can actually create customized reports and draw down data and Excel charts and whatnot. So I'd encourage you to visit AGED and look at the data. So you probably already know, but some important dates, just as a reminder, the federal fiscal year, which is what the OAPS reporting system is on for state ombudsman, begins October 1st, 1 year, and September 30th, which is tomorrow. So we have a federal fiscal year ending and another one beginning here shortly. Again, NORS data is reported annually based on the federal fiscal year, not the state fiscal year. The Office of the State Ombudsman Program reports the previous federal fiscal year NORS data during the month of January each year. So please follow your state's guidance on timely submissions of data into your software system, including case closure timeframes and regular review of data trends, which we have a lot of resources about data management that I'll go over in just a moment. I share this background information with you, and I'm sure Louise may have some additional input, but I find it really helpful to know where the data goes once you submit it, especially whenever you're talking to volunteers to help them understand the importance of submitting their reports. It really goes local, state, and federal, and it's important on every single level. So our resources, I hope that you're familiar with these. There we go. We provided direct links for you. As I mentioned before, we have a main landing page that has the NORS training materials. Also on that page is a link to the NORS data that I just talked about. And then we created over time NORS frequently asked questions, which we did have a few FAQ dialogues, I believe last year or the year before. So check out those FAQs, especially if you have some questions about how do I code INA? Is it really INA or is this a complaint? When do I open a case and when do I document it as an open case, et cetera? There's really great FAQs that of course were developed in response to the questions we received from the network. If you look at the FAQs, we have both I'd say pre-COVID FAQs, and then we have FAQs developed specifically for documenting your activities during COVID-19, because we know that those activities were very different. Look at both of those resources. If you have any questions that aren't on there and you'd like to suggest them, please send them to us. So here is the NORS online training course that I mentioned earlier. This is linked directly on that main landing page for NORS training. You'll see this video right here. And if you have not done any courses, NORS or otherwise, on the Consumer Voice NORC On-Demand Training Center, please watch that introduction video. It'll give you a really good idea of what those courses look like. And that is simply an introduction to the NORS course. It'll give you an overview of what you'll learn in the course, how it operates, etc. It'll even explain how you can download your quiz answers and share them with your supervisor. So right below the video is a blue button that simply says NORS Online Training. Click that button and you'll be directed here. Oops, not there. Remember, if you hit a button, it's going to change it. Sorry about that. It takes you outside of our main NORC website to our Moodle Rooms courses. And you'll have to create an account if you don't already have one. But again, the introduction video will show you how to do that as well. And if you have any questions or you're struggling getting in, you can let us know and we can assist you with that. But this would be an excellent training, especially since a lot of stuff is not done in person right now, that you could share with your volunteers or anyone else that's in training, or perhaps someone that you feel needs a refresher on documenting their activities. So here are a couple other resources that I mentioned in regards to data management and ensuring NORS consistency. We provided a checklist. As you may recall, NORS was revised. So there was a whole lot of training, not just NORS and those revisions, but on the state ombudsman side, on the state level, OAPS, the older Americans Act performance system, was new. And so there was that training going on as well, trying to help state ombudsman.
Okay. How you
Katie,
doing?
can you?
I'm doing just fine. I wanted to follow up with you from yesterday.
Okay, sorry about that. So we created a checklist at that time when NORS was being revised to help walk representatives through all the resources and, frankly, steps to become familiar with it. But this may be something, even though we're past that period, this may be a good checklist for you to pull out annually or with new trainees to walk through what you need to know for NORS. And then in addition to that, there's a data management guide that goes more in depth about considerations for creating a data management plan. It speaks to both at the state level as well as at the representative level. So there are examples and tips and links to additional resources. So you may want to check that out, especially if you manage a local program. Okay, so if you need technical assistance, please reach out, of course, to your supervisor or state ombudsman first. But if you need additional assistance, you are more than welcome to reach out to us, either at our general Ombuds Center number or to Carol or to Maria. Maria is the consultant I mentioned earlier, and Carol Scott is on our staff. So I'm going to go ahead and turn it over to Louise for your remarks, Louise. And you may need to unmute on the computer as well as your phone if you're using both like me.
I'm just on the computer. Thank you, Amity.
There you are.
A few comments. First of all, I just want to thank everybody on the call for all of your work, especially the above and beyond you've had to go through during the outbreak of COVID and then the various fits and starts with stopping visiting, restarting visiting, challenges with visiting, having to be very creative in how you approach residents and reach them. And so I know you've all been through a lot. And in the middle of all that, you had new data collection, new codes, fewer codes, improved codes, I hope. So you were adjusting to that in the middle of all the COVID work. So thank you for all that. I know it was very hard to not be able to visit, and that is reflected in the NORS data, and I'll talk a little bit more about that in a minute. But, and I know for some of you, there was a lot of angst that you no longer had the infection control complaint code. So, that was, in hindsight, probably should have hung on to that one. So Amity, if you could go to the next slide. I did want to let you know, though, that we have done some slight modifications to NORS. So every 3 years, we have to request to the Office of Management and Budget approval of our data collection instrument, which we call NORS. And so we did do that. We have to inform everybody publicly through our website, and we had a Federal Register notice. So we proposed some modest changes. We had feedback from state and local ombudsman representatives. And so we have added back in the infection control complaint code. So that's something that will be effective October 1st. I know that means for those of you that your state ombudsman will have to work either with their vendor or their software designer to add that code back in. So that's going to happen. And then there's just some tweaks to the language in the like reporting tips, the business and tips and reporting tips, and a little bit of tweaks in the definitions, but otherwise it's not a very significant change. Now, what I wanted to also mention, and I don't have a slide for this, but just to tell you a little bit of what the 2020 NORS data looked like. So a few things. What probably will not surprise you is that complaints overall did drop, although they didn't drop as much as I thought they might. And so we saw a 23% drop in complaints. We did see a 13% drop in the number of volunteer representatives. As you might also guess, routine visits, that means that there was a visit at a facility once in each quarter just to provide routine access. Very, very few facilities got that kind of routine access visit. However, I'm really thrilled to say that with our new NORS data collection, we know how many visits were made in fiscal year 2020, and it was a lot, even though you were banned for several months. I'll read you the exact number, 191,214. I didn't say that right. 191,214,000 visits. So that is pretty amazing. And what that means is that 87% of all nursing homes got at least one visit. And there's over 15,000 nursing homes. 44% of all residential care communities got at least one visit. And we have almost 60,000 residential care communities. It's 59,000 and change. So that is really great that we can reflect your work more comprehensively. So I'm kind of preparing some high level data to share within ACL, and pretty soon we'll have more broad sharing of the data. I have been using it in a variety of ways for internal work at ACL, also in sharing some information with our federal partners like Centers for Medicare and Medicaid Services, or CMS. And we're still kind of analyzing some of the data. So it's pretty exciting that we are getting the data in this new format where we can look at who you referred complaints to, what types of entities. No surprise there, licensing and certification is the most common entity that gets a referral from the program. But we're able to validate that now and see it, and then see who's the second and who's the third. And so that's very helpful. And also resolution of complaints, much more detail on how effective are we at resolving complaints that residents bring to the program. So still looking at that kind of data, so stay tuned. And let me see if I have any other comments. No, I think that's all my comments. And I also want to thank NORC for all of the amazing training that they've put together on NORS, and continuing to provide support and update frequently asked questions. And they are an incredible resource. So thank you to Amity and the team for the work that you've done.
Thank you so much, Louise. Appreciate it. So Louise will stay on the line with us during our discussion as well. So if we have any questions that I cannot answer, I will happily defer to Louise. All right. So like I said, for these quarterly TA talks, we're just going to briefly talk about a topic, hit some high points, and then leave plenty of time for Q&A. So that's what I want to open up right now. If you have any questions, raise your hand. There should be a raise hand icon and we can ask you to unmute, or you can submit your question in the chat box. No questions at all. There we go. There's something. Let's see. Louise, a question for you. What was the most common problem encountered with the states turning in data, and can we get training in it?
You know, it's interesting. I think the most common problem was, I think there was a couple things. One was because we had a new reporting system, as you know, OEPS. There were some things that states had to do that they've done before in the old system and had to put in the new system, like reporting conflicts of interest, reporting on their facility types with more specificity. The residential care community types. So those were things that sometimes there was a little more back and forth on. Now that it's in the system, it'll be really easy to just roll those over to the next year and make edits if you need to. The other challenge, it's a perennial challenge, is getting the funds expended information accurate and into the, and then reported. That seems to delay programs from kind of finalizing their report. Yeah, that's so that's kind of where that's at. Trying to think if there's, but otherwise I think it went pretty well in terms of using the new system. I think for people on the phone who are at work at the local level, what's important is that you get your data in routinely so that when it is time for the state ombudsman to report to ACL, that it's ready to go, because the complaint data is a file upload now. So they can only report on what's in the system. And if it's not there, it doesn't get counted, obviously. So yeah, thanks. I see some more questions.
Thank you. Good question. And other questions about the infection control code, asking if we could actually have that code now in order to start updating the software program.
So I will try and get something out this week. Now what was I going to say? It is in the draft. So if you saw the draft tables that we submitted to OMB, it is in there. I don't remember off the top of my head where it's located in the complaint list. Anyhow, I don't know, Amity, if you all could just post the draft tables, that would be an option until I get it out with the official approval date on.
Yeah, if that works for you, we'd be happy to post the draft tables, and I'm writing it down so I don't forget. And then we also are finalizing our quarterly Ombudsman Outlook e-newsletter that goes out at the end of each quarter, and there's a NORS corner in that, and so we can put the update in there as well. And if you are hearing about the Ombudsman Outlook for the first time and you're on this call and you obviously don't receive it directly, please email the Ombuds Center address and send us your contact information. We'll make sure that you get that. It's packed with lots of updates from ACL, NORC, other federal updates, especially since COVID has been, taking over our lives for the last couple of years. So it's important to read that for updates. And then it also highlights some successful practices that your peers are having across the country. So if you don't receive that, let us know. So another question, and feel free if I'm not stating your question correctly to raise your hand and we can ask it verbally as well. But is there consideration to change the requirement to be in the facility once every quarter for it to count for the entire year?
So I'll go ahead and answer that. So
yeah, thanks.
There's not a requirement. There's not like a mandate that says ombudsman programs must visit a facility every quarter. And so, but what it is it's a definition. It's sort of a measure of are the facilities getting what we would consider routine access by the Ombudsman program? And our measure of routine access, it is a very high standard. It's one visit in each quarter, and the visit is for the purpose of providing access. You might get a complaint while you're there. You might participate in a resident council meeting. You might walk the halls. It's, you know, there's a lot of good descriptions of what that looks like on the NORC website. So go from what we have in writing, not my off the top, you know, thing, but we have some good descriptions of what a routine access visit looks like. Okay, so, and that measure that the program is providing routine access is once in each quarter. And it is a very high bar. So if a facility closes in quarter 3 and there were only 3 visits made, it's not going to show up as routine access. But now we have additional information. The visits will still count. If there were 5 visits made in those 3 quarters, those 5 visits are counted. That facility is still counted. It is a facility that got at least 1 visit. So we're expanding how we capture that information. So I was so relieved this year that our data changed in time, because if we didn't have the expanded visit information, it just would have looked like programs did almost 0 visits in fiscal 2020. And that's not true. They did over 190,000 visits. So I can boast about that. So I hope that helps. We're really trying to, it's a measure of in-person access. That's what we're trying to get at. Oh, someone can't hear me. I'm sorry.
I can hear you fine, Louise. So I don't know. I'll respond to Jean.
Okay.
See what's going on. So thank you for that answer. And I was trying to see if I could stop sharing this screen to share my webpage, but didn't want to mess anything up. So I just want to reiterate, go back a few slides. We will share these slides and the recording after the live presentation, and visit our FAQ page. And that's where you'll see how Louise was talking about our question and answer, specifically about what counts as a routine access visit and why. So please check that out. And it may give you some language that would be helpful when you're training volunteers and working with your peers. So another question, expand on OAPS. Is that how you spell it? Yes, that is how you spell it. So OAPS, OAAPS. That's the Older Americans Act Performance System. And it's the system that not just the Ombudsman program reports their annual data in, but all Older Americans Act programs now. So it merged and put all of them under the same umbrella. And is the information available to local programs? It's only, access is only available for state ombudsmen or their designee if they have someone in the state office that assists with data. However, AGID, that website I showed earlier, and then our website where we post data, that's where you can at least see the output of all the states entering their information into OAPS. So anything else do you want to add, Louise, to that?
Well, you can go to the OAPS website and like look at the resources if you're curious about it. I'll put it in the chat box, but you know, it's not, I would say if you had to choose your time between looking at the materials on the NORC website and looking at the OAPS, I'd say spend your time on the NORC website. Looking at the NORS materials. Yeah, so, but there it is if you just want to take a look at it. And I see Jody had a question in the chat. Just to clarify, are we to work with our software program to get the infection control code back up? What will that code be? So stay tuned, we'll get out the revised table soon. And some software, the state admin user can just add the code in pretty easily. Others, it might be more complicated. So, you know, it just depends on your software system.
Thanks, Louise. We had another question, and I'm putting the link in the chat right now. asking if the Ombudsman Outlook archived issues are available on the website, and they are. So the link is right there. And if you're on our homepage, you just hover over Library, and you'll see the drop-down box, and you can click on Ombudsman Outlook. Thanks for asking. All right, I'm going to scroll back up. Thank you for the OAPS link. And it looks like the audio issues are fixed. Good to hear. All right, any other questions? And let me see if there's raised hands that I'm missing. Nope, I don't see any raised hands. All right, just one second. All right, just making sure I didn't miss anything online. If you do have a question and you don't want to raise your hand, you can unmute your line directly at this point. Can I see a show of hands? I think I can check the participant list out of curiosity. Click the little raise hand icon if you have used our online training center for any course, NORS or any other one. Oh, yay, and I forgot there was an icon for clapping too. So thanks for that, and some thumbs up. Good. That's great. I'm glad to see so many coming in. So we have about 6 raised hands, 13 thumbs up, and some clapping hands. So good. I hope that you find it useful. We're hoping to, as you may have seen in some email blasts, that we are very excited to share that we did receive Consumer Voice, the grant again to operate the Resource Center, and it's a 5-year grant. And we have a pretty robust work plan that I'm very excited about, which includes creating some continuing education videos to really fill up that online training center, some quick videos that you can use in training for continuing education and start some conversations with your folks. So glad to see that you're using it. And if you haven't yet, I hope that you will after today and go and check it out. So I do see some raised hands. Not sure if you're still raising your hand in response to my question, but if you are raising them to ask a question, feel free to unmute. I see Eileen has a hand up, Carol, and okay, you're putting them down or unmuting. Feel free to ask a question if you had one. Nope, okay, thank you. Good, I'm glad, Laura, that you think updated videos would be helpful. We agree. Okay. So, Louise, we have plenty of time left in the call, but it looks like questions have slowed down. Do you have any other comments you want to share? And then I'll go through the rest of our slides.
I don't think so. I just want to encourage you to, use the NORC materials, share them with whether it's volunteers or other staff. And thank you again for all of your hard work during these challenging times. And yeah, I think that's all. Thanks.
Thanks, Louise. So speaking of the NORC materials, we will update the NORS training materials with the addition of the infection control code. So look for those in the coming weeks once everything's finalized, and we will notify everyone that they've been updated because we want to make sure you're using the most recent version. You'll see some notes on that webpage about the training materials that they were updated periodically. And I also want to just say some of those updates are in response to you using those materials and having questions or questioning our answer to one saying, I think the code would be better as this one instead of this one. And so we do value your input when you use these materials. If you see something that you don't understand or question, please let us know, or that you need more of as well. I also wanted to say, if you had some of your coworkers or volunteers try to join today and they ran into errors because it was full, please let them know that we thought we had addressed that before opening it today, but apparently we didn't. And so that's a technical issue we obviously need to sort out, and we will notify everyone that registered as well. But just if you could do that, I would appreciate that. Here is our contact information for myself, Louise, and Maria. Feel free to contact us directly. And as I said, we will share these slides after the presentation today. If you have not connected with us, we are on Facebook, we are on Twitter, and we even have an app now. So I encourage you to download the app if you haven't already. You can search for LTC Ombudsman Resource Center. And no matter what type of phone you have, the app will be compatible. So please download that, share it with your representatives as well. The whole idea was that you would have resources in your hand when you're out in the field and hopefully make your job a little easier. So as a reminder, we want your input. Oopsie, I was trying to click. Let me copy this into the chat. We want your input for today's call. And if you want, instead of emailing us, you could always, in the evaluation, put what topics you'd like to talk about in future calls. So let me type this into the chat. So hopefully it'll be easier for you to just copy and paste into your browser. But we would appreciate your feedback because we do adjust our presentations. We develop resources and other presentations based on your input about what you need. So with that, I'm going to do one last scan of the chat. I don't see any other questions. And again, I do apologize for the technical issues that we experienced, but this is what happens when you try new things, right? So, but we will have it down, and I'm so excited to see your faces, and it's great to connect with you, and we hope to do more of these so we can connect with you one-on-one and just in a more direct way. So thank you so much for all the important work that you do in the field. As you can understand, we want that important work documented accurately. So keep it up. Let us know if you have any questions. Speak with your supervisor or state ombudsman as well. Thank you, Louise, for presenting today and for your remarks and support from ACL. That really means a lot. And thank you all for being here today and for your great questions and comments. So please fill out that survey, and I'm going to let you have a little bit more time back into your day because we all know you can use it. All right. Take care, all. Thank you so much.
Bye-bye. Thank you.